Alright, so my presentation is about maternal mortality. So mothers dying during pregnancy and during childbirth. The goal is to obviously reduce the amount of mothers that have health complications during their pregnancies. We were able to, the final statistic you can see here, 45% reduction in maternal mortality. So this is a big improvement. The goal was 50%, so they almost got there, but not quite. Still a big improvement in the health of pregnant women. In September of 2000, building upon a decade of major United Nations conferences and summits, world leaders came together at the United Nations headquarters in New York to adopt the United Nations Millennium Declaration, committing their nations to a new global partnership to reduce extreme poverty and setting out a series of time-bound targets with a deadline of 2015. That have become known as the Millennium Development Goals. So that's the overview of all of the goals we're talking about. Mine is the Millennium Development Goal number 5, to improve maternal health. So, what does this encompass? It encompasses reproductive health and reducing maternal mortality. So, what can we do to get there? How do we reduce maternal mortality? Number 1, contraceptive use. This is shown time and time again over many statistics and many different groups of people. If women and men have access to contraceptives to prevent pregnancy in the first place when it is unwanted, that will reduce the number of unwanted pregnancies, and it will reduce the number of women who get sick or die during their pregnancy. Number 2, education for young women. When young women are educated, when they have the opportunity to go to school and to try and find work, there is a significantly lower rate of maternal mortality. Number 3, urbanization. This is basically access to health care. When women are living in cities with access to hospitals, of course their health care is going to be more affordable and better quality than women who just live in rural areas on farms. Number 4, schooling midwives. Midwives are people who assist in births. Getting them the education, training, and knowledge that they need to be successful in their jobs is very important. And along with that, number 5, getting these midwives to the women who need them. Midwives being able to travel to rural communities that don't have access to the same kind of hospitals, or women who don't have the money to go to a hospital, getting these midwives to these women is a great influencer. And also, free healthcare. We have the economy to create healthcare for everybody. Enacting those policies and reducing the cost of paying for healthcare is a huge influencer in the health of pregnant women. Next, so what are the stats right now? From 1990 until these stats were last updated in 2013, we're looking at how many women died per 100,000 births. In sub-Saharan Africa, it was reduced by 49%, from 990 to 510. So a big reduction in maternal mortality in sub-Saharan Africa. Even bigger in Southern Asia, from 530 to 190, 64% reduction. Oceania, a 51% reduction. Latin America, a 40% reduction. So we can see that we are making progress on this goal, and while we didn't exactly hit the target in 2015, still significant improvements were made. How are we doing so far? Since 1990, the maternal mortality ratio has been cut nearly in half. Most of this reduction has occurred after the year 2000. More than 71% of births were assisted by skilled healthcare professionals. This is an increase from 59%, so a 12% increase in getting midwives to women who need them. In developing regions, 56% of births happen in rural areas, and they are attended by skilled healthcare professionals. In urban areas, that number goes up to 87%. So we can see this big difference in rural versus urban areas as far as women getting access to the skilled professionals they need to have a safe childbirth. Only half of pregnant women in developing regions receive the recommended number of prenatal or antenatal visits. Pregnant women, the minimum number suggested is 4 visits. So basically once every other month. Almost 50% of women are not getting even these once every other month visits to their doctor. So increasing the amount of, the frequency of their doctor visits is really important. So first we're going to talk about skilled healthcare professional. 1 out of 4 babies worldwide are delivered without skilled care. This is an easy to fix number, training more workers, getting them to the women who need them. We can see the statistics all across the world over on the left here. We can see the light colored number is in 1990, the middle one is in 2000, and the dark colored one is in 2014. So in developing regions at the bottom, we can see we started at 57%, now we are up to 70% of births that have a skilled healthcare professional assisting them. And in the world, it went from 59 to 71%. We have the rural-urban gap. This is what I was talking about 2 slides ago. The difference between women in rural areas without good access to hospitals and healthcare versus urban areas where there's more economy, more money, and the women have the ability to go to the hospital and have their recommended number of antenatal visits. We can see this huge gap here, right? The red number is the rural areas, the blue number is the urban areas. There is a big gap there. So trying to reduce that gap, getting rural women the care that they need is a big source of the inequality and the cause of maternal deaths. Profound inequalities in access to and use of reproductive health services persist across regions. In the developing regions, there is a 31 percentage point gap between urban and rural areas in the coverage of births attended by skilled health personnel. But even this large disparity masks the range of inequalities among regions. I talked about contraceptive use. I realize you probably can't even see this at all, it's too small, but I'll read it for you. So, the proportion of women using contraception has increased from 55 to 64% worldwide during this 25-year span. So we are doing good in getting people the contraceptive methods that they need. This has contributed to reducing unwanted pregnancies, unsafe abortions, and maternal deaths. 9 out of 10 users of contraceptives were using them effectively, accurately, and they succeeded in preventing unwanted pregnancies. These include sterilization, oral hormonal pills, IUDs, condoms, injectables, or implants. All of these contraceptive methods are successful and helpful at reducing the number of unwanted pregnancies, which will lead to either unsafe abortions, young women forced to give birth, or things like that. 12% of women, unfortunately though, want to use contraceptive methods and do not have access to them. So reducing that number is really important. All right, antenatal care. Getting women to see the doctor before giving birth, at least 4 times during their pregnancy is the minimum recommended number. Ideally, it would be much higher than that. Only half of pregnant women receive the recommended amount of antenatal care. The World Health Organization recommends a minimum of 4 antenatal care visits during pregnancy to ensure the well-being of mothers and newborns. During these visits, what are they doing? The women should receive at least a basic healthcare package, nutritional advice, and they should know about warning signs that will identify possible complications. In Southern Asia, we have increased this number from 23 to 36%. Sub-Saharan Africa saw a smaller increase from 47 to 49%. Northern Africa, though, great increase from 50% of women receiving this up to 89% of women receiving at least 4 antenatal care visits. The developing world as a whole went from 35 to 52%. So we are seeing increases across the board on the number of antenatal care visits pregnant women receive. This is a hard topic to talk about, but adolescent childbearing. Across many portions of the world, girls aged 15 to 19 are still giving birth in really unfortunate numbers. Adolescent childbearing can have harmful consequences for the health of both the adolescent girls that are having the kids and the kids themselves that they are bearing. Early childbearing also reflects broader forms of social and economic marginalization of girls. If a girl has a kid at age 15 to 19, she will be largely unable to continue her education and find work. So it really contributes to the subjugation of women across the world in developing regions. Intensified efforts are urgently needed to delay childbearing and prevent unintended pregnancies for this age group. One part of the solution is increasing their opportunities to go to school and eventually engage in paid employment. Women who have more education are much less likely to have a birth during their adolescent period. These efforts will not only improve maternal and child health, but will also contribute to reduced poverty. We can see in the developing regions across the world in 1990, 64 out of 1,000 women aged 15 to 19 were pregnant and gave birth. That is an alarming statistic. There are a lot of young women out there who are either forced or uneducated into how to avoid pregnancy at a young age. Something to keep note though, we do have a lack of data. We're talking about maternal mortality. Why women are dying when they are pregnant. We don't always know the cause of death, whether it's due to complications with pregnancy or something else entirely. So this light section here, this is the data that we don't have. This is no data reported. The middle section is we can source some sort of data, but it's not of an official capacity. And the dark blue is official government data on the cause of death. So increasing our ability to collect data on how these women are dying and why these women are dying is essential in our goal to prevent them from dying in the future. All right, where do we stand now? Maternal mortality has declined by nearly half since 1990. While falling short of our goal in 2015, 400 maternal deaths per 100,000 was in 1990. Now we're down to 210, almost a 50% reduction. Skilled personnel assisted births increased from 59% to 71%. So we're making progress there as well. Adolescent women aged 15 to 19, we have unfortunately seen a very small reduction in this from 64% to 56, or 64 births per 100,000 to 56 births per 100,000. So a very small percentage decrease there. That is a big area to work on. Also, contraceptive use has increased by 9% in those 25 years. And a lot more women worldwide have access to contraceptive methods. So, while not all of the goal's exact targets were reached, significant progress has occurred. Improvements in every single area were seen, especially in developing areas. The biggest success is just reducing maternal mortality, reducing the number of moms who die during pregnancy and childbirth. We saw great increases there. The biggest failure, reducing adolescent pregnancies and childbirths. We saw, unfortunately, low increases in, decreases in the number of adolescent women giving birth. Oh, sorry, that was the slide I just read. And here's the statistics at the end. We can see in Africa, moderately high to very high mortality. Nowadays, low or very low mortality. We can see basically every yellow and red means moderate to high, and all of the green or dark green is low or very low. So we can see significant reductions across the board to maternal mortality, adolescent birth, access to health care, and access to contraceptive methods. All of it has been improved. So we are on our way, but there is still more work to do. Thank you.